I'm Helen Harris, and today I want to talk to you about return on investment. In December 2013, I noticed the theme and logo for the National Public Health Week 2013 on the cover of my copy of The Nation's Health, a newspaper of the American Public Health Association. The theme is Public Health is ROI, Save Lives, Saves Money. These three words, return on investment, how simple it sounds, and how can this be applied to public health? I was curious and listened closely to TV and radio ads over the next several weeks. My primary interest is prevention and public health. How might this all be related? Return on investment and caring for self and community. Costs of healthcare continue higher, as do the insurance premiums we paid that are covering our visits to our provider and for hospitalization. This all seemed timely as the new year came in with a bang, and pledges of making changes to improve one's health was the topic of the media. Certainly, Boston's citywide challenge in 2012 to collectively lose 1 million pounds in a year faced slim odds, as have other city challenges across the country. Advertisements play a big part in making people aware of the importance of health. In their effort to endorse products, they inadvertently provide people with information on current developments in the health sciences and make everyone understand the importance of staying healthy. The ad about shingles and the zoster vaccine is a good example of this. TV advertisers know that actions speak louder than words. Kellogg's Cereal Special K has a catchy ad, "What will you gain when you lose?" is their endpoint. And periodically, Blue Cross Blue Shield of Minnesota advertises their Just Do campaign. Just get out and do something. Another one is about asking questions. I love this one, but I can't find it anymore on the web. The couple is at a restaurant, and the woman has so many questions about the menu items and how things are cooked and where do they buy their produce. I almost expected her to ask if they wash their hands regularly. Then we see her in her doctor's office, and when asked if she has any questions, she just shakes her head. No. I know that return on investment is a financial term. For a given use of money is an enterprise, the return on investment, ROI, is how much profit or savings is realized as a result. Or an ROI analysis indicates how much financial gain a hospital can obtain from each dollar it invests in their quality improvement program. But I was interested in how it could be applied to health change. What would be my return on investing in a lifestyle change, for example? Every year in the United States, 7 out of 10 deaths are due to preventable chronic diseases, such as diabetes and heart disease. Chronic diseases account for a whopping 75% of national health care spending, yet only 3% of our healthcare dollars goes towards prevention. 4 health risk behaviors, lack of physical activity, poor nutrition, tobacco use, and excessive alcohol consumption, are responsible for the development of many of the most prevalent chronic conditions. By one estimate, more than 3/4 of all deaths can be attributed to tobacco use, poor diet, and physical inactivity. Preventing chronic diseases by modifying risk behaviors will ultimately help people live longer, healthier lives, and help keep healthcare costs down, that return on investment. I'm concerned with rising chronic health issues and what that means not only for the individual but their family, and by extension the team of people they work with. Diabetes, high blood pressure, heart disease, obesity, and chronic lung diseases, the prevalence rates are alarming. Maybe ROI can be linked to healthy individuals and by extension communities and nations. How do we get there? Established through the Affordable Care Act, that was signed into law in 2010 and upheld by a challenge as to its constitutionality by the Supreme Court in 2012, the Prevention and Public Health Fund expands and sustains efforts to prevent disease, detect it early, and manage conditions before they become severe, and it provides states and communities with needed resources to promote healthy living. The fund is a substantial investment that moves our country from a sick care system that manages illness to a well care system that promotes maintenance of health and prevention of disease. This has the potential to be a paradigm shift in how we deliver health services in the U.S., a monumental change. Sick care versus wellness care. If you knew that for every $1 you invested that you would get $5.60 return, you would most likely make the investment. Research from the Trust for America's Health shows this return for investing in proven community-based public health programs. I'm beginning to see ROI in neon colors as it relates to health prevention and promotion. For ROI to work in the public health arena, there has to be ways to quantify the health benefits and indicate decreased health costs for the major chronic diseases. According to the Wall Street Journal, in January 23rd, 2013, Louisville, Kentucky has made more headway in their health quest by building bike paths, selling healthier foods in low-income areas, and a new local ordinance requiring certain restaurants to post calorie counts on their on-site menus to make healthier choices the easier choice than when they were doing a pounds lost campaign where everybody was to lose a certain amount of pounds. ROI, individually and collectively, it's change in habits, having an improved lifestyle versus the loss of pounds. So it's more than just losing the pounds. It's a lifestyle change and investing in ourselves and our community. Being part of the community discussion and working on initiatives that work. Having ordinances and legislation that makes poor health choices harder to make. By default, we choose the right one, the healthier one. The 2013 National Public Health Week theme was developed to highlight the values of prevention and the importance of well-supported public health systems in preventing disease, saving lives, and curbing healthcare spending. National Public Health Week is the first week of April, but I'm working on my health ROI now and will continue the whole year. Thank you.